You're watching the Fox 5 Morning News at 9.
Now, kids going back to school is still a big issue around the country. The CDC just released a new report on how kids may spread COVID-19. Dr. Richard Chaffoo joins us now to explain the findings. Good morning, Dr. Chaffoo.
Good, Kristina.
We're so glad that you're here because, I feel like a lot of the information keeps going back and forth, back and forth. It's hard to tell what we're supposed to pay attention to. So first, let's start with this. So children of all ages, they're able to spread the coronavirus, correct?
Yeah, absolutely. That's a great point, Kristina. In fact, a recent study came out. They looked at a group of campers from Georgia, and these were campers. The average age was about 12, and their staffers were 17, and they all were tested for COVID-19 prior to camping. And after they've been at the camp for a week, about 75% of them, of the campers and the staffers, actually tested positive for COVID-19. So I think what's important, if we look at the situation with these campers, is like we said earlier on, I mean, COVID-19 survives in a host, a human host, whether it's a child, whether it's someone that's a young adult, middle-aged, or an elderly person.
Okay, sorry, let me just make sure I got that right. So you're saying that they tested negative prior to the camp, and then a week into the camp, 75% of them were positive.
Exactly, 75% of them did. And what they found, Kristina, was that while the staff were not required to wear a mask, so of course many of them were not, they weren't social distancing. They were also doing a lot of singing and yelling, and we understand that this is, of course, a respiratory illness, and that can propel the virus, fairly long distances, 10, 15, 20 feet. And they also were not frequently disinfecting surfaces. So it was sort of predictable that this outcome would occur, but it highlights the importance of understanding that this virus affects people of all age groups.
Okay, so what type of symptoms then do children exhibit?
So they can have symptoms like, for example, headache, fever, sore throat, but most importantly, about a third of these people, and we're seeing this probably nationally, had no symptoms. These are called asymptomatic carriers, and they are probably responsible for seeing a large part of, the spread of this virus. Because obviously if you're feeling ill, you're more likely to stay home, you're more likely to see your physician, you're less likely to socially contact other people. But often many people will have few, if no symptoms whatsoever, and this is what's helping to drive this virus.
And it's interesting, before I get to the next question, doctor, I had a friend who said that his house, they became infected. So he and his wife he says that they were very ill, very sick for about 10 days. And then their kids, they have 2 kids, also got it. But they had it positive, and then by 2 days, they were fine. So do they exhibit, do they suffer from, severe types of symptoms, or is that less likely for children?
So there's a whole range actually that you can see in all age groups. We have seen some, unfortunately, deaths in relatively young, healthy people. This thing called COVID storm, where the immune system was so strong, it overreacted and damaged the lungs, and these people unfortunately passed away. So it's something that can affect any age group, and certainly if you're young, it can be a very serious and life-threatening illness. So it's not something just because you tend to be young, you're likely to have mild symptoms.
Okay, so what should parents do, just to make sure that their children are healthy and they stay safe?
Well, I think the most important thing is to continue doing what the CDC has recommended to all of us. We all need to wear a face mask, and we want to ensure that face mask is clean. If it's a cloth, we want to wash that. We want to avoid crowds and practice social distancing, 6 feet. And obviously, we only want to run essential errands. Like in my household, I'm sort of the sacrificial lamb, so I'm the one that goes out there to the stores and, picks up groceries and picks up other items. And then you don't want to forget to frequently wash your hands. Again, if you don't have a sanitizer, remember warm water and soap for 20 seconds, and make sure that you're disinfecting surfaces, contact surfaces where the virus can survive and remain for several hours.
And then lastly, is it safe? Because a lot of parents who have children who might be sick are afraid to still take them to the hospital. So should they still be taking their kids to the hospital?
Absolutely, and I think that, Kristina, you bring up a very, very important health issue. You know, we've seen a drop of routine immunizations for kids by up to 40% in the state of California, and maybe up to 20% for the influenza virus vaccination. So it's very, very important that children remain on their immunization schedules. My daughters are going off to USC this fall. I just got them appointments. They went in, they got their immunizations. My smaller children who are in elementary school had their appointments set up. And this is for several reasons. Number one, remember that these diseases that we have children immunized against are completely preventable. And they have very serious complications. Whooping cough can put you in the hospital. Measles can have serious complications, right. Respiratory, neurological. And if you combine a respiratory, neurological, or say the flu and COVID-19, the results can be catastrophic. And again, it's just being a good citizen. You want to make sure that you're keeping not only yourself healthy, but those people around you as well.
That's right. Okay, Dr. Chaffoo, thank you so much for all that information this morning.
Thank you.
Be safe.
You too.